Hello, everyone. Thank you for joining us here today. My name is Sam Watson. I am an outreach specialist here at the National Network of Libraries of Medicine, Greater Midwest region. Um, we are here to talk today about getting started with community health and information outreach. I am new to this office, so this is kind of giving me my first practice with some online instruction. So thank you for joining us here today. And I am currently at Iowa City, where the weather is sunny, windy, but not as cold as it could be for mid-February. So I'll let Jacqueline introduce herself.
Thanks, Sam. I'm Jacqueline Leskovic, and I am the network librarian for the Greater Midwest region. I've been with the Greater Midwest region for a number of years, working with the office when it was located at the University of Illinois in Chicago. Speaking of Chicago, I have the wonderful pleasure of continuing to live in Chicago and telecommute to Iowa City, where Hardin Library, the RML office, is located. Sam?
All right. Well, as we get started here today, just kind of some brief housekeeping notes. We are recording this presentation. We also provided a handout, so I'm going to put this in the chat box. But this handout here, if you go to this link, there is a Word document that you can download, which will point you to all of the resources we'll be covering today so that you don't have to furiously try to scribble them down as we are talking about them. As well as we will also talk about the continuing education credits for the MLA. At the end of this presentation, there will be a slide with instructions on how to redeem continuing education for the hour contact that we are doing here today. And again, I pointed you towards the chat box. We'll be asking you some questions here today. So feel free to, we would like to hear your input. So just be aware of the chat box and feel free to share your ideas. So let's practice this. All right, we are. These are some of the joys of partnering with hosting duties, and we're in different states. So our objectives today here, we want to define cultural competency, kind of start at a baseline here. So what it means and how we see it day to day, and how we can internalize it with our programming and outreach needs. So we're going to try and show you how we're going to connect cultural competency with health information outreach. Another thing we're going to cover today is examining ways to learn about your local communities. We want to talk about the resources out there that you can employ to learn about people in your area through a variety of online sources, free information that can really help you do the research ahead of time before you start implementing any programs. And then finally, we'll talk about ways that you can learn about programs that may have already been implemented. So we'll discover some ways of applying the principles we talk about today into cultural competency and creating outreach and programs of your own at your institutions or on an individual level. I'd like to reiterate that this will kind of be a summary information. We're just here with you for an hour, so we can't cover everything, but we're going to point you to a lot of resources that can help you with outreach further in the future as well. So first things first, I'm having trouble with the slide here, Jacqueline. Could I have you advance that? Thank you. So I'd like to kind of get, again, a baseline of how we interpret culture. So I'd like to ask you out there, what does culture mean to you? If you'd just like to take a moment and think about it, type it in the chat box. You know, it's a pretty broad term, so it can encompass a lot. And I'd just like to ask what it means to you. What comes to mind when I use the term culture? So.
All right, so we got a shared set of beliefs and traditions among a group of people.
Yes,
thank you, Emily.
Anyone else have some interpretations out there? Jacqueline, if I asked you what culture means, what would you associate it with?
I agree with Emily that it is a lot about shared beliefs and traditions. It can be a social sharing. There are ways of communication. It can be within institutions. ethnic, particular populations, groups. We have here how groups interact from one of our participants, Ayaba.
A collective way of living and values, yes. Yes, effective social interactions. These are all very, very good. So let's see. Yeah, I'm still having trouble. If you could advance that for me, Jacqueline. Thank you. So yeah, we're covering a lot of these terms, beliefs, customs, values, institutions, behavior, actions. All these things kind of make up culture. And if I kind of take a definition from the CDC, it's the thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. So again, a lot of what you contributed, it pertains to what culture means. Another way to look at it metaphorically is kind of like fish in a fishbowl. We're all kind of swimming in our own fish bowls, and culture can be the water that makes up what we're swimming in. But we just may not be aware of it. It's just all around us constantly. And so we have to think about when reaching out to others that other people are in their own fish bowls and their water may have different properties than ours. So being aware of those differences is how we can do that, because it's important, because culture affects all aspects of our interactions with others, whether we're of the same culture or not. So sorry, Jacqueline, could I have you advance? Thank you. So what does culture have to do with health? Well, it impacts it in a large way, and here's some of the ways that they can intersect. So it can culture defines how healthcare information is received, how rights and protections are exercised, what is considered to be a health problem, what you may consider something you need to go to the doctor immediately for, might not be the same thing that someone else sees it as. Same thing with symptoms and concerns about the problem and how they are expressed. I could use an example. My wife and I definitely see symptoms and how we treat them, where I tend to muddle through and persevere. She'll let me know as soon as possible if there's something wrong. So again, how people interpret their problems. Again, who should provide treatment for the problem, and what type of treatment should be given. So these are all the ways that culture can affect health information and information provision. Thank you. So building off of that, if that is culture, we talked about what culture is. What actually is cultural competency? Well, if I'm taking the definition from Improving Cultural Competence, it's being aware of integrated patterns of human behavior that include the language, thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. So again, that's very similar to what culture is, but competency really just makes yourself aware of how those things all interact. And again, when we are doing outreach, whether at a library or a health institution, we want to create policies that are a set of behaviors, attitudes, and policies that come together in a system, agency, or among professionals, and enable that system, agency, or those professionals to work effectively in cross-cultural situations. So again, that's kind of a way of saying that, as our health system moves towards patient-centered care to improve the quality of health and to reduce cost, patients and providers need to work together. So again, trying to lower those barriers to healthcare and make sure everyone is understood and comprehending. So we can talk about, language barriers, but it's not just about the words. A great NNLM resource you may be familiar with, Medline Plus, also has a iteration in Espanol, but it's not just a simple translation of English to Spanish. There are interpretations made with culture in that, because interpretation goes beyond merely translation. So let's talk about some symbols, or way we can see this beyond, again, just language. So an example I like to use is an owl, or maybe another bird of prey. You may be familiar with the owl as symbolizing age or wisdom, a kind of omniscience to it, but it's generally I would say a benign presence. But if you consider maybe a Native American interpretation, or some Latin American cultures can see an owl as a symbol for death. And so if you think about the mascots of Frontier Airlines, who uses an owl prominently on their fin, that may mean something different for a community that you may not have thought about before. Again, I like to make an equivalent. If you were going to be buying plane tickets to travel soon, would you use a airline company that had the Grim Reaper on the side of the plane? It may kind of interpret how you view that organization. But again, these can also go beyond language. They can go beyond symbols as well. There's also nonverbal communication. In some cultures, making eye contact can be a sign of boldness or challenge, or a smile can be seen as agreement or acquiescence. So again, just being aware of how your actions and how your outreach can affect different people in your community. And again, pulling this into how it affects health, being culturally aware lets you know about beliefs about objects, symbols, food, the body, blood, non-traditional medicine, all these kind of things, communication styles and norms, the role of relationships between individuals, ways of learning new information, how people go about finding information, the roles of translators and interpreters that are maybe work with you, and again, a perception of authority figures, how people view those in providing the information or who are providing the care for them.
Sam?
Yes.
I'm happy to say that Frontier Airlines removed that symbol from their tail fin.
They did. All right. Well, there you go. Because again, as you are made aware of those things, then changes can come about. So, all in the name of progress. Thank you, Jack. Can I have you move? Yes, thank you. So again, we're talking about cultural and cultural competency. There, are also legal guidelines that are in place that we need to follow and consider when it comes to culture and cultural competency. So we have the Civil Rights Act of 1964 that states that no person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in or be denied benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. So it's in law that we need to be aware of cultural competency. This also goes for policies within the Health and Human Services organizations, where they have a class standards. It stands for culturally and linguistically appropriate services. Again, that just related to culturally, again, as a way of reaching out to communities and putting policies into place at your organizations. And finally, if you are currently working at a hospital or a health system, you may be aware of the Joint Commission. And again, their focus is that it's more than just a patient's rights issue. It's also critical to the safety and quality of care when it comes to patients and healthcare information. So finally, we can just talk about ultimately what this is all for when talking about cultural competency and health care outcomes. We're looking to improve the health disparity among minority groups in our community and just in the world in general. So by doing this and thinking about cultural competency and reaching out to communities, you're allowing them to make informed healthcare decisions. You let them comprehend their health information so that they can read graphs or charts or navigate, say, an electronic record system, or be able to calculate or reason numerically with proper information. And then it also lets them navigate the healthcare system in general. We can talk again about language that patients can understand and comprehend. So these are all the things that we're ultimately aiming for when reaching out to communities, and that we can help to lower healthcare barriers. And so that's kind of a broad overview of culture and cultural competency. And so now we're going to talk about some resources from Jacqueline that she did some research on for us.
Sam, before I begin, I wanted to mention that we will we can stop now if anyone has any questions for Sam on this part of the presentation. We also will have some time at the end of the session so that we can answer any questions that you might have. So right now, anyone have any questions for Sam? You can unmute yourself or you can put your question in the chat box. All right. So Healthy People 2020, which is from the Department of Health and Human Services, defines health equity as the attainment of the highest level of health for all people. To achieve this health equity requires valuing everyone equally with focused and ongoing societal efforts to address these avoidable inequities. And there are some historical and contemporary injustices and that we can pay attention to that affect how health and healthcare disparities have evolved. The United States is home to more than 43 million immigrants. Among this population group, 21.2 million are limited English proficient, or LEP. And when we're talking here about culture, as we talked about, it's a number of groups and the shared set of beliefs and traditions. And so we're not just talking about immigrants or refugees, but we're talking about the medically underserved and underrepresented groups across our nation. So with that in mind, it's time to do a needs assessment and some environmental scans to see what kind of service needs exist in a particular community. Well, here we are on the internet, of course, and because of the internet, it's relatively easy to find data about communities, which can help us in determining the right mix of services and information that are the most relevant and appropriate for that specific community population. Things to know: predominant languages spoken, ethnicity, race, age group percentages, socioeconomic status. All those can provide a snapshot of the community. One of the best resources that we have for finding information, our demographics, is from the United States Census Bureau. The Census Bureau is a lot more than just numbers and coming around every 10 years and knocking on the door. It is actually a division of the U.S. Department of Commerce, and as such, it provides numbers on the population and economy. If you go to the census.gov site, you can look in the section About Us, and you can learn about a little known program called the State Data Center. These, another way of doing this, if you don't want to go through and look through the About the Bureau, look in the advisors and centers and research programs, there is a really easy to use search box on the website, so you can just type it in and it will suggest the relative information. For example, I tried putting in State Data Center and it gave me the options that I was looking for. We'll also be talking a little bit about state and county QuickFacts, American FactFinder, and ways to learn about people and households. Getting back to the state data center, each state has one, and its role is to provide access to this U.S. Census Bureau data. This is one of the longest and most successful partnerships of the Census Bureau, and actually was created back in 1978. I had no idea that this existed until I started doing some research about it. The purpose is to make that data available locally to the public through a network of state agencies, universities, libraries, and regional and local governments. So the SDC, lead organization, is appointed by the governor of each state, including Commonwealth, such as Puerto Rico. Another part is that a few years after the inception, the Business and Industry Data Center program was added to meet the needs of local business communities for economic data. So this is also helpful for us as we're doing some research about our potential community outreach. A little more in detail here, the American FactFinder, also part of the US census.gov. It provides access to data about the United States, Puerto Rico, and the island areas. The data in there comes from several censuses and surveys. So even though the last census was in 2010, some of the information comes from other sources and is a little more up to date. You can look at the section on the top there, which says using FactFinder and what we provide to learn more about the popular facts that they present, such as population income, education, and age. And these results can be filtered down to the zip code. You can go in and you can enter a state, county, city, town, or zip code, and you can get the information through the Community Facts text box. The Community Facts page displays after you click the Go button, and it shows you the population of that geography that you centered. I'm just going to make a little note here. I put in Cook County, and I had the option of 3 different states: Cook County, Illinois, Cook County, Georgia, and Cook County, Minnesota. So I think it's kind of interesting to take a look and see some of the information about how it varies from these reports I picked up, and you'll see them in contrast as we move along. The other option here is that you can click the links under popular tables for this geography, and you can see the tables containing other data for your community. There is also a guided search and an advanced search to help you get through all the data in American FactFinder. Another resource from the Census is the state and county QuickFacts. Those are also from the Census. You can see here on the screen, we've just moved over to Cook County, Minnesota, and we see their population estimates, much larger than what we saw in Cook County. Where was that one? The other one was from Cook County, Georgia. And the details here are pretty intense. You can see the latest information here. We have some estimates from 2017, even though the census is from 2010, divided up by age and sex. And ways to look at it is that you can just enter your state, county, city, town, or zip code and select a fact. Now, the information in here only comes from cities and towns with a population of 5,000 or more. Looking in a little closely, this is what we could do if we were to drop down the box. This is the select a fact box. So if we were going to put in education, we can see that in Cook County, Minnesota, the average education level is greater than that of the average in the United States, and also that they have a larger percentage of bachelor's degree or higher in people who are 25 years and older. This is one of the most useful tools for from the Census Bureau. This is called the Data Mapper. If you go to the geography link at the top of the page, look for maps and data and go to maps, you can see the Census Data Mapper, or you can just put in Census Data Mapper in the search box. This is a web mapping application, and it's intended to provide users with a simple interface to view so that you can save and print county-based demographic maps of the United States and also the data. So you can just see when you look at this map, to me, it just screams data. And from the drop-down boxes, we can learn about age and sex. That can be divided down to male, female. We can look at people who are 65 and over, the number of percent, the median age of males and females. Another option would be population and race. That's divided by African American, white, Asian, Hispanic, or Latino. We can find information about family and housing. Family households are the options, non-family households, average family size, percent occupied housing units, the homeowner vacancy rate, as well as the rental vacancy rate. I think that might be useful in terms of considering homelessness, density for populations, all concerns that might affect one's health. This map is customizable down to the choice of colors. You can also put in distinct classes for your data representation. This one here, for example, you see that you could go from all the way up to 5 classes. This one on our map is showing us 3. The only downside I see to this mapping function is that you need Adobe Flash Player, and it crashed just as I was creating this map. So that's, yeah, I guess that's just part of the ball game there. To print a map, you can use the Adobe Reader, and you can download data into Excel. Here is an example of a mapping. I put in the data theme of population and race. The data table that I wanted refers to the percent of American Indian and Alaska Native people. The map I have just highlighted to the greater Midwest region. Those are my colors that I chose, and I put the number of classes as 5. So if you take a look over in the lower right-hand corner, you see that there are 5 categories that are divided up and represented here. So if we go up to Wisconsin and all the way over to, looks like South Dakota, you're going to see that there's going to be a large percent, maybe as much as 96% by the dark violet color. In the gray areas, 0 to 19.2%. And that's not very explicit data, and it's really not going to help us a whole lot. So the key here is to use the best classification type. I chose equal interval, so there are your 5 categories, 20% in each. But if we change this to an from equal interval, and we go up to the quantile function, we can see what a big change this is in our presentation. This is a very powerful map. I mean, this is very, very precise. Because it's in a quantile, you see that the most dense areas are from 1.1% to 96%, and the white areas, or slightly gray areas, depending upon your monitor, have gone down tremendously, and now that white area represents 0% to 0.2. And again, this is the area that you really have to make sure that you pay attention to in order to get a map that will capture the kind of information that you're looking for. PH Partners, I hope that you have heard of PH Partners before. It's another resource from US government agencies. The mission is very similar to the mission of the National Network of Libraries of Medicine. The mission of PH Partners is helping the public health workforce find and use information effectively to improve and protect the public's health. Several regional medical librarians worked with the public health librarians and those agencies to put this together, to pull together this resource. You can sign up for email updates if you wish on your topic of interest. There are 2 main categories there we see. We have the public health topics page, and we have a main topics page. Looking in just quickly under the public health topics, you see we can look at things like dental public health, which might be very important if we're looking in a rural area or in an urban area. There's also a section on nutrition and obesity. Probably really important in knowing if that particular population has a high propensity for diabetes. HIV and AIDS information, definitely one of the categories that the National Network of Libraries of Medicine focuses on in terms of making sure that this group receives the resources that they need. And then we go down to the main topic pages. These talk about such things as health promotion and education. You can pull out health data tools and statistics. One of the things I found out in doing this is that there is the map that you can pull up from this is zoomable. So you may want to consider this as one of your resources. And again, none of these resources that we're talking about right now are necessarily going to give you everything that you want. We'll talk a little bit later, briefly, however, since we've condensed this presentation just to an introduction, sort of to get your feet wet, to see what's out there. Because this class normally, when it's taught in person, is a full 4 hours with hands-on experience. Speaking of hands-on experience, if you have any questions anywhere along the line, your regional medical library can help you go through any of these resources and help you develop a project or program if you're interested in doing outreach. And one of the things that I always remember, one of my colleagues used to say that if you're going to do outreach, you have to leave the parking lot. So we're not talking about in-reach. That is within your own community, within your own organization. These are unaffiliated areas that we're talking about. Those of you who are health sciences librarians know about MLA, but this is the other MLA. It's called the Modern Language Association, and they did redo their website. So they moved this particular mapping option to a new URL, and it's under their apps. You can look at the languages that are present, taught in a particular state, and you can limit these to languages other than English and other than Spanish. And these include Arabic, Chinese, French, German, Italian, Korean, Tagalog, Russian, Portuguese, Polish, other languages, Korean, Vietnamese. So you see there are quite a lot of information that you can pull out this in terms of languages that are taught. And I see if we were to guess that there are a number of other languages and Spanish spoken in North Dakota, but the predominant language that is taught, and that's what we're talking about, we're talking about the prevalent language that is taught, seems to be German. In the GMR region, we have developed a map, and you won't be left out, because the same resource that we used to create this map came from the county health rankings and roadmaps, and their subtitle is there, Building a Culture of Health, County by County. This is under the countyhealthrankings.org. This particular map was created by the 2016 County Health Rankings and Roadmaps, and the darkest color represents the most marginalized counties across the Midwest. Other information came for this map from the American Community Survey websites. If you wanted to look for the same information in your area, you can go in and you can take a look. This County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Public Health Initiative. And there are ways here that you can pull various social and economic determinants, some of the demographics we just reviewed throughout the United States, looking at where people live, work, play, to see how various factors positively or adversely affect their health outcomes. For example, if a community has a high percentage of diabetes, what factors are at play? Is obesity high and contributing to diabetes? If so, why is obesity so high? Is it related to food insecurity? What about the presence of parks or recreational areas to exercise? And you can see that these are divided up into 4 categories of health behaviors, such as tobacco use and exercise, clinical care, the access to care that participants have in that particular county, as well as the quality of care that they receive, and social and economic factors that will come into play. And finally, the physical environment. We talked a little bit before about housing and transit. How do people get around? Are there a number of homeowners present, or is this a rental community, etc.? So a lot of information that we can think about. If you are interested, coming up at the end of this month, on February 27th at 3 p.m. Eastern Standard Time, there is going to be a webinar explaining the new 2018 County Health Rankings release. So if you're interested, you can go to that website, countyhealthrankings.org, and you'll see a banner that you can sign up for the class. And they will talk about the 2018 County Health Rankings, and they will include a focus on health equity. Because I think that's actually what we're talking about. When we're talking about health, we would like quality health for all. Other tips are featured there under tools and resources, so take a look and maybe learn more from the webinar. So there are other ways to think about who is in your community. You know, we got a lot of numbers here. We have maps, we got diagrams, we got data, but I think most importantly is to think about who is in your community. You may be surprised really at the information you already know, or know if you think about it. Who are the people you see each day? Where you live, where you work, play, worship? What about in your grocery stores? I know when we moved from one community to the other, there was a big change in the population in the grocery stores. The type of foods that were available. Many of the grocery stores do cater to the needs of the community. And there are different prices also based on the community. So some of the stuff, think about these ideas, jot them down, and bring it when you meet up with your outreach team if you have one. If you don't have one, make one. So here's our checklist. First of all, define your audience. If you go in, you may actually learn that the community itself doesn't know what it needs or what it is missing. You may actually be able to help them find out. Sam will talk a little more about the resources from NNLM, including from the National Evaluation Office, but here's a quick quote that I like to call forth, and that is, we consider health information outreach to be promotional and educational activities designed to enhance community members' abilities to find and use health information. And this is from one of the books from the National Evaluation Office as part of the National Network of Libraries of Medicine. Consider your information resources. Sam briefly mentioned Medline Plus and Medline Plus en Espanol. So, of course, this is always our favorite website to go to and for consumer health. So we wouldn't be the National Network of Libraries of Medicine without it. Also, ways of engaging your community, maybe create a survey or a focus group, and you just might want to simply start with the question, how does the community get their health information? Who do they trust? How can I improve upon that? Think about school and friends, libraries, social media, cable news, their doctor. Also consider your community. Where do they gather or congregate? Is it in the schools? The role of the public libraries, clinics, hospitals, public health agencies, faith-based organizations or associations? Where do they live? Where do they work? Where do they play? Is it a church or mosque or senior center, a grocery store, a barber shop? Actually, the National Network of Libraries of Medicine funded an outreach project through a hairstyle salon, because that was one place in that particular community that was a base for people to gather. So in order to access community, to find these answers, or to join their projects and activities, it's important to get community buy-in. You have to engage them. You need support from a trusted and known person in the community and someone who is key for education and outreach. Some of these people might be community pillars or the early adopters. And with that, I'm going to pause for a second and see if you have any questions about this section. Sam?
All right, thank you, Jacqueline. Okay, so we're back here. We've got, we're all culturally competent now. We have looked at some resources and done the research, and we know who we want to outreach to in our community. So the next step we want to take is about actually creating projects or developing programs that we can utilize at our organization. So I'm going to start here with advertising, again, some further NNLM resources. We offer a number of classes like the one you're currently attending, but ones that go a little bit more in depth. We have a From Beyond Our Borders course providing multilingual and multicultural health information. I know we spoke about language not being the only barrier, but it can serve as a large one. So this course kind of presents resources that are selected for the emphasis on providing culturally relevant information in the preferred language of the population. We have another course called Health on the Range, Rural Health Issues and Resources. This one describes hallmarks of rural America, identifying other access challenges in living in rural communities and equipping the audience with tools to serve the health information needs of those living in rural communities. We also have a promoting health literacy through easy to read materials. Again, we're wanting to get people to understand the health information that is coming their way. So this course is a hands-on class that will discuss the frequent disconnect between information providers and information seekers. These are only 3 courses that I'm describing here, but Jacqueline offered some as well. And again, if you go to the link there, you can see we offer a whole bunch more specifically on outreach to underserved or underrepresented populations that may be in your community. And finally, we are nearing, oh, actually, can I have you go back one more, Jack? Thanks, sorry, thanks. We are nearing our funding window for the NNLM with the in the next couple, or the next month, really. So if you go to this website here, you can find out how you can get support both in creating and funding for developing outreach programs in your community. You can work with your regional managing library to just get assistance with questions you may have or ways to get more information. So I encourage you to check out that link just to get, again, both financial and informational support. Okay, and next, you also want to get inspired by what projects you want to create for a community. So there's a number of different resources for going and seeing what's already been developed or what has already been implemented at different levels throughout the country. Again, I'll offer an NNLM resource. If you go to funding/funded web link there, that actually gives a history of all of the projects and all of the programs that we have funded in the past. And the nice thing about this resource is that you can filter the options to get specific populations that you're trying to reach. So you can filter it by seniors or teens or Native Americans or African Americans. And it really lets you see what projects have been implemented throughout the country that have been utilized with NNL funding in the past. It also lets you separate by organization. So depending on where you're currently working, if you're at a hospital or say an academic library or a public library, you can also filter by that as well to, again, help you get ideas that are more focused to where you are working. Another resource is under the Health and Human Services umbrella, and that is healthypeople.gov. And this is under the Office on Disease Prevention and Health Promotion, but it offers a wealth of stories and opportunities to partnership with others. It focuses on encouraging collaborations across communities and sectors and empowers individuals towards making informed healthcare decisions. And lastly, we have rural health. Again, depending on where you are located, ruralhealthinfo.org offers a way of just connecting with people in those communities, and whether that may be a farm bureau or faith-based organizations. It offers kind of the health challenges that those that may face living in rural communities. So again, a great place to get some ideas. And so finally, um, you're culturally competent, you've done the research, and you're creating a program. Jacqueline had mentioned this during her part as well, but National Education Office under NNLM offers these great planning and evaluation guides. So there are actually 3 parts of them, and they are free and downloadable online, but they kind of can help you walk through the process of creating a program for outreach. So getting started, planning outcomes and what you're aiming for. And then also, we really won't have time to talk about it here today, but really getting to evaluate and to assess the information and the success that you may have had with your program in order to build and iterate upon it. So I highly recommend checking out these resources if you're wanting to go more in depth and get a better idea of structured project planning. So finally, again, we're doing a lot of talking at you here, but we'd also like to hear from you. So you out there listening, are you planning on participating in any outreach in your community? You can let us know. We've got the chat box there, but feel free to unmute yourself if there's anything that you are currently hoping to plan. I guess I could ask Jacqueline, have you worked on anything recently for community outreach?
Oh, well, so here we have,
Oh, okay.
yeah, a couple of responses. Emily here says she works for an optometry college in rural Kentucky, and they're looking at ways to expand vision care to our populations. So that's great. That's since you are in Kentucky, member of the GMR, let us know how we can help you with that.
Yes.
And then, oh, good. Matt says that he has a team that he's working with. So that's great. And he's hoping to do that in the not too distant future. And I chimed in with, I am working with our partner outreach libraries. They are our boots on the ground, as it were, and they're the ones who work within their own communities for providing health information access. We also have Catherine here who's saying that she has their undergraduate medical students and that they are placed in community service organizations. Aha, looking for a way to work with them on projects. Sounds like a great opportunity. Yeah, and then we have a hospital library, which is open to the public. So we're looking for ways to reach out to them and not just having the patients of the hospital. Well, that's great. I'm really glad. I'm really excited that that you all have some ideas, and hopefully the information that we have provided for you today will help you achieve your goals.
All right, yes, these all sound like great ideas. And again, yes, we are happy to help, and so will your regional managing libraries as well if you want to reach out to them. So as we are closing here today, I just want to offer some parting thoughts kind of to think about as you move forward with community outreach with health information. We encourage you to think about cultural competency. What are the gaps in healthcare in your community? Who in your community might be facing barriers to health information, and what are those barriers and what causes them? Again, we gave some examples of language, beliefs, and interactions, and just kind of how it all fits together under the cultural banner. We next ask you, like, where are you going to go to learn about your community? We offered you some resources, but again, what research are you going to implement in order to have an understanding of your community before creating some of these programs? And then finally, what sort of project are you going to implement? What ideas? We saw some great ideas here in the chat box about what you guys plan on doing. And just thinking about what your game plan is for approach and how you can hopefully build off of it to create larger and better programs as well. Again, I will encourage you to check out the NNLM funding that will be happening at all your regional libraries, because it's a great opportunity to, again, get some help with creating projects, as well as get the funding to be able to afford to do it as well. So I know that's going to be available here for our office, but as well, a lot of the other offices are starting their funding windows as well. So check those out. And Jacqueline, would you have anything to add to this here? I guess we also will take any further questions if anyone has some pressing questions that we did not cover today.
I'm waiting for the questions,
Okay.
if any. And if you don't have the questions now, please feel free to contact us. There are, you see on the screen, our email addresses. We're both based at the University of Iowa, Hardin Library for the Health Sciences, which is in Iowa City, Iowa. And we'll be happy to direct you to the right person if it's in another area, or chat with you ourselves. So one last chance here. Anyone care to unmute and to ask a question or put a question in the chat box? Okay. Some of you may be, and it looks like from the responses here, in health sciences libraries and hospitals, and some of you may be public librarians. I just want to let all of you know that if you are interested in getting the consumer health information specialization from the Medical Library Association, this current class is worth 1 CE towards that certificate. And you can find out more information about the Consumer Health Information Certification from the MLA website. So congratulations on successfully completing this course, our 1 hour of getting started with information outreach. If you would like to complete the evaluation, and we would like for you to complete the evaluation, even if you're not interested in getting your MLA certificate of credit, please go to www.medlib-ed.org, log in with your MLA Net login, and if you don't have a login, just register as a guest. And then after you set up your MLA account and you're logged in, you click the Medlib Ed on the navigation bar, and then you'll return to the Medlib Ed page. Also, you can see, in order to learn more about Medlib Ed, you can see the frequently asked questions in the About menu, and you will have 30 days from the date of completion of this course, that is 30 days from today, to complete the evaluation and claim credit. So after you go in, after you log in, enter today's course code, which is info0218, as in info, February 2018. So it's info0218, and complete the attestation and the evaluation and claim credit. If you have any questions about this, follow up with Medlib Ed, because the certificates come from the Medical Library Association. Well, Sam, any last words before we say goodbye?
No, I just would, again, like to thank everyone for being here today and for participating. And again, we are happy to answer any and all questions when it comes to outreach programs or health information provision.
All right, so don't forget Medlib Ed between the Medlib and ed.org. And this class code is info0218. And on that, I'll say goodbye. I'm ending the meeting now. Thank you.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.